The Development Governance International Foundation has called on government and partners to support the group as it strives to make healthcare accessible to the most vulnerable groups across the country. The program director of the organization, Dr. Gafar Alawode, who made this known in an experience-sharing forum on universal health coverage in Abuja, lauded the support of the international NGOs like Action Aid to the program. Participants at the event say the project is making an impact as more people are now aware of the health benefits available to them and are utilizing the resources.
So it's very, very important for us to share experience because we've been able to come up with some solutions to problems that prevent people from accessing healthcare, and we think is part of the solution. We have implication for making progress towards universal health coverage. So the project actually look at how do we make sure that the informal sector people, the poor and the vulnerable, are able to we are able to increase their uptake of health insurance, and when they have health insurance, how do we increase service utilization? So we work with a lot of our community resource people. We mobilize them, we train them, and then with funding from the Christian Aid, we are able to buy health insurance for poor and vulnerable people, especially in the Kefi local government. And because of that engagement, we're able to increase service utilization among the poor and the vulnerable people. And let me give you an example. An average person that does not have health insurance in a community, let's say 100 people that don't have health insurance, maybe throughout a year, it's only half of them who are able to go to a health facility only once. But among the cohort of people that we engage, we discover that at least they're able to go to a health facility like 3 or 4 times to be able. That means the financial barrier is removed. Financial barrier to accessing healthcare is removed, and we're able to achieve a lot of results in terms of strengthening the relationship between the community and health facility, and strengthening the interface between primary healthcare and secondary healthcare through strengthened the referral. And again, as a result of the result that we've seen, we have seen a lot of well-meaning members of the community that buy health insurance for other poor and vulnerable people. And we thought this is type of a model that we should, replicate, and then before replicating it, people should know about it. It is important because we have other government schemes like Basic Care Provision Fund and Equity Fund that actually did not perform as much as the UAC project that we did in terms of utilization of our health services. And we really want to propagate the community approach that we use so that at the end of the day we can replicate it. We did not limit the community engagement through maybe World Development Committee alone. We work with the members of the informal sector group, Association of Transporters, Association of Tailors, Association of Okada Riders, and all those stuff like that, religious leaders. We brought all of them together. That composition of the community structure is very, very important. Number 2, we try as much as possible to work with more committed members of the community. So it's not enough that I'm a member of the World Development Committee and I've not attended the meeting the last 2 years. So we are trying to work with people that are more committed, and maybe part of what actually work very, very well is that this community structure that we work with, one, they are enrollees. They have health insurance. And secondly, they are following up with those people that are enrolled. When last did you go to a health facility? When you are sick, are you going to this facility? Are your children going to this facility? I think that follow-up actually did the magic in terms of increasing utilization.
Health insurance scheme is something that has come to stay because in Nasarawa State it's mandatory. So it's a journey that we've already started and we're not stopping. So whatever that is happening in Kefi is going to eventually spill to all the 13 local governments. Kefi's on is because of the support that has gone in there. So it has been able to strengthen the World Development Committee chairman across the wards. So, and that's why you can see the utilization is far, far better there than other LGS. So almost everyone now in Kefi knows much more about health insurance scheme compared to other LGS. Fantastic, sensitization, and all the activities are always publicized there. So people are aware and ready to take responsibility for their health. And it's because of this program that we've seen people come to even pay for those that can't afford it. A footballer the other time came and paid for 100 persons in Kefi. There is someone that also paid for 10, 12 persons like that. So because the awareness is much improved now. Impact is always the long time effect of any intervention. So if you want to say impact, if I have to put it except I have to just say it as a layman. We've had people that have been treated because Christian Aid paid directly on their behalf, as in they paid for the health insurance for 12 months. So we've had a lot of people that have had surgeries. We've had some people that have had cesarean section. So children have been delivered because health insurance scheme provided by the Christian Aid, assisted them in paying for their bills. So apart from people just being aware, the impact has been felt, and I think that the well-being of people that are enrolled directly, have improved, and they're doing better. Not just well-being, even economic, benefit is there. Some can now use their money for other things, maybe put their money on investment, petty investment, because they don't have to worry again, keeping money to go and pay for their healthcare services. That's the economic benefit as well.
I am a pensioner and I've been sick for a long time and I don't have money to go to hospital. And from my organization, the amiable vocal person invited our organization to attend the presentation meeting. So I happen to be one of those that my Amira sent me because I'm from Form 1, which is Federation of Muslim Women Association in Nigeria. When we went, we held the meeting and he gave us the presentation, the importance of this health insurance, how it helps people, the vulnerables, the less privileged people in the society. And we attended the meeting and the DGI happened to enroll me to be one of the beneficiaries. So from there, I was given a card that I should attend primary health care in Sabongeri. When my body started, I went to Sabongeri to attend the clinic there. Fortunately for me, they could not treat me. They don't have the facilities, the equipments for the test. So they called Lafia, the state headquarters, and they gave the code from there. And they fill a form and they refer me to Nagari Hospital. I never knew that it was OSA that has been disturbing me. So when I went there, test was done on me, and they found out that it is OSA that is disturbing me. When they gave me treatment, they gave me drugs and injection. With the help of this health insurance, they help me, they help humanity in my area. You can see me, I can wear this and I can dance. Now, before I was walking like this, but now I am upright.
When this program comes to our humbling town, Kefi, they invited us to come and attend one program in Kefi Hotel. It happened to be isolated to attend that training workshop, being from the Crescent Edge in that Kefi. So happened they said there's a chance given to us. So as a resource person, so when I was there collecting that chance, it happened to me when they come and enroll me. They enrolling me, they give me one ID card. They say anytime that I'm not feeling fine, I should attend the primary health care. It happened that one day I'm not feeling fine, so I went to the primary health care there. They rendered a service to me by doing tests. When they test, they say it's a malaria and also there's a typhoid. They give me some drugs, I go home, I take it. Based where they're describing to me, I only follow the procedure of that drugs they give me, I come healthy and happy.